Genetic counseling. Genetic counseling is a process that deals with the patients or with the relatives or family members that are suffering from inherited disorders. In this process, genetic counselors advise the patients or the relatives about the consequences of the disease, that what can happen in future or currently what can happen to the patient, or is there any risk to the family members or not. It will also tell the patient about the complete nature of the disorder. Then genetic counselors explain the chances of developing the disease and transmitting it to the family members. Keep in mind that the inherited disorders, which are also known as genetic disorders, are not at all contagious. But if the couple is carrier of any gene mutation, then they can transfer the genetic disorder to the offsprings. So in such situations, genetic counselor open the options in front of the patient or in front of the family members, that the choice is of patient's own regarding the management and the family planning issues. Now, what is genetic counselor? Genetic counselor usually have a master degree in genetic counseling, but people from the field of biology and nursing are also moving towards this field of genetic counseling. Now, as a genetic counselor, one should have a complete understanding and adaptation to the medical, to the physiological and familial applications of genetic contribution to diseases. Now, these genetic counselors, they work as a team, and they once they come to know that this family is suffering from the genetic disorder, then they interpret the family and medical histories, draw a pedigree. Then they have a duty to educate such people about the inheritance of the genetic disorders, about gene testing, about the management of the disorder, then how they can prevent the transmission of the disease from the parent to the offsprings, and what are the resources that can flare up the disease. So genetic counselor somehow promote informed choices and adaptation to the patient health risk. Now, genetic counseling session structure is divided into 5 phases: intake phase, initial contact, encounter phase, summary phase and the follow-up phase. Now keep in mind that the intake phase and the follow-up phase takes place outside the session, while initial contact is the contact of the genetic counselor with the patient or with the relatives. In encounter phase, there is a dialogue exchange between the genetic counselor and the affected individual, while in summary phase, genetic counselor put all the options in front of the patient so that they can choose the techniques or the methods for management and for family planning. Now, genetic counseling is required when there is a family history of genetic disorder. For example, the couples are carrier of cystic fibrosis. Then what are the chances that their offspring will be affected? And what is the importance of prenatal testing just to diagnose the abnormality in the neonate? Then molecular test can be performed if there is a single gene disorder, for example in case of phenylketonuria. Now, genetic counseling is also required when there is increased maternal age, that is above 35 years, or increased paternal age, that is above 40 years. So अगर माँ की उम्र 35 से ज़्यादा है या बाप की उम्र 40 years से ज़्यादा है, again genetic counseling is required. Then genetic counseling is required if the test such as alpha-fetoprotein in maternal serum is positive. So any abnormality which is found in the maternal serum screening results, then in this case genetic counseling is there. Then abnormal ultrasound also requires genetic counseling when the Down syndrome features appear in the infants. Strong family history of cancer, predictive testing of adult where the conditions get open at the age of 40 or later, such as Alzheimer's disease.